According to the American Cancer Society, 1 in 6 men will be diagnosed with prostate cancer in his lifetime, and more than 240,000 men are diagnosed with the disease every year. Therapies for prostate cancer, they've definitely improved, but most men, though, suffer a side effect of sexual dysfunction afterwards. A new study, though, has found that counseling can actually help, and here to explain the findings from the study is Dr. Donica Moore, president of the Sapphire Women's Health Group. Dr. Moore, thanks for being with us today.
Thank you, Dan.
Okay, so obviously sexual dysfunction not only affects the man, but it also affects his partner as well. So, I mean, this is something that two people have to deal with.
Absolutely, and this study showed what I call a duh finding. This wasn't groundbreaking research, but it's something we don't think about and we don't think to talk about, either with our patients as doctors or our partners as spouses. And what this study showed is that men who went through treatment for prostate cancer, either surgery or radiation therapy, who went directly into couples counseling with their spouse, either face-to-face therapy or internet-based therapy, had reported much better sexual satisfaction at 3 months, 6 months, and even a year after follow-up, after only 3 sessions.
Wow.
So the punchline here is certainly anybody who has a partner with any kind of sexual dysfunction problem would do well with couples counseling. But the other surprising finding is that the spouses of the men also reported much higher sexual satisfaction than the control couples who did not go through any kind of internet or face-to-face based counseling.
The sexual dysfunction, is it a result from the testosterone levels being affected? Is it...
In some cases, men have their testosterone levels affected if they're on chemotherapy afterwards. But the primary problem is erectile dysfunction. And this could either be from the extent of the tumor. So just to review what the prostate is, it's a walnut-shaped sized gland, about this size normally. But when it becomes enlarged through cancer or other tumors, it does have to be removed. And there are very important nerves that run through that piece of real estate. And it's located between the bladder and the rectum. But what the job of the prostate is to produce a very important part of the seminal fluid. So men who have treatment for prostate cancer, either surgery or radiation, most men who have surgery for prostate cancer will have some kind of erectile dysfunction afterwards. And it's important to remind people, too, when doctors and patients are communicating about the sexual side effects of prostate cancer treatment, the medical definition of sexual success after surgery is defined as being able to have an erection 50% of the time. I don't know too many men or women who consider that success.
50% of the time, right. And so really the crux of this study is basically showing that counseling does work.
In part because you're managing your expectations. Now, first of all, of course, it's very natural for men to feel like a failure if they have impotence, erectile dysfunction, or decreased libido. And then it is very natural for the spouse, even though they know their partner just had prostate cancer and surgery in that delicate part of the body, it's very natural for women to feel like, this is my fault, I'm not attractive enough, he must be interested in somebody else, our marriage is falling apart. And so, of course, couples counseling can help not only manage the expectations, but also manage the communication
because
process.
You've also got, obviously, the cancer scare, which manifests a lot of the worries and concerns for both the man and his partner as well. This study was also done in conjunction with couples that were also taking the man was taking erectile dysfunction medication?
Not all of them, but some of them were. And this shows that just taking a pill for erectile dysfunction can help, but it can't get you to sexual satisfaction scores that they were seeing in both partners. And I think the punchline here is that while only men are diagnosed with prostate cancer, women are also greatly affected by it as well. And that's why there's a wonderful organization called Women Against Prostate Cancer, which does have a website, and they provide a wonderful sexual intimacy fact sheet, which I think that alone, if every woman who was involved with a man who had prostate cancer, and we're talking millions of women who are involved with millions of men who are prostate cancer survivors. We're always talking about how many men per year die of prostate cancer.
Right.
But there are many, many, many more who live beyond, and many years and decades beyond it.
And it's the recovery and it's the moving on from that it's also very crucial.
Right, and sexuality is a very important part of their recovery and their relationships and their lives. And that's something that we sometimes get embarrassed to talk about, but it's a very important thing, not only for doctors and patients to talk about, for patients and their spouses.
Well, as you say, it may seem like this kind of obvious result finding that, but at the same time, it sounds like it could be giving some encouragement for those that are surviving prostate cancer and for their partners as well.
Yeah, and we always think about couples counseling or marriage therapy as this thing that you only go to as a last resort when things are terrible. But we have to rethink that. Again, not only for people with diseases like this, any type of cancer certainly affects the entire family. And any type of counseling can really help patients and their partners work together as a team and also to manage their expectations.
Some invaluable information, Dr. Donica Moore. Thank you so much for being with us today.
My pleasure.